Good evening, you're watching 7 at 7. I'm Preeti Chaudhary. All right on the top of the bulletin, I want to quickly take our viewers through the numbers that India is recording as per 6:30 p.m. on the 1st of April 2020, where coronavirus is concerned. The overall numbers, viewers, as it looks right now, stand at 1,725 with 54 deaths across the country. This is the number across India right now. 1,725 are corona positive patients and 54 deaths have been recorded. Let's move on to states right now. Let's cut across to Maharashtra. Maharashtra has recorded 321 positive cases with 12 deaths. The other big surge has happened in the state of Kerala, 241 positive cases with 2 deaths. However, till now, the state of Tamil Nadu was not registering the kind of growth that other states was, but unfortunately, the state of Tamil Nadu now also in just 2 days has recorded a surge of 124 positive cases with 1 death. All right, so that's the latest in terms of numbers. We've taken you through the 3 states which are recording the maximum numbers. And on the other hand, we've given you the basic number of corona positive cases across the country, which stand at 1,721. However, in midst of all of this, the death toll due to the coronavirus pandemic has risen to 53 in India. A 25-year-old died in Uttar Pradesh's Gorakhpur after contracting coronavirus. It is the first death in UP due to the virus. Meanwhile, active COVID-19 cases have crossed 1,500 in the country, standing at 1,721. As we took you, Tamil Nadu has now sudden surge reporting of 110 new cases of COVID-19. All cases are now linked to the Jamaat meet which happened in Nizamuddin. 2 fresh cases were reported from Noida near Delhi, taking the total number of active cases in the region, which is Noida, to 41. In Delhi, a doctor working at a state cancer institute tested positive after meeting his brother who came back from the United Kingdom. The hospital has been shut. There are 112 active cases in the capital. 18 new cases were reported today in Maharashtra, 16 from Mumbai and 2 from Pune. Maharashtra is now the worst hit state in India, with active cases at 269 and positive cases at 321. Kerala is the second worst affected state with 219 active cases of COVID-19 and 2 deaths.
देश में 1251 कंफर्म केसेस आए हैं और टोटल 32 डेथ्स रिपोर्ट हुई हैं। पिछले 24 घंटों में 227 नए कंफर्म केसेस और 3 नई डेथ्स रिपोर्ट हुई हैं। ये डेथ्स गुजरात, वेस्ट बंगाल और मध्य प्रदेश स्टेट से रिपोर्ट हुई हैं। केसेस में आए इस इंक्रीज का कारण है कि कुछ लोकेशंस पर लोगों के सपोर्ट ना मिलने से, समय पे सूचित ना करने के कारण अचानक केसेस की संख्या में ये इंक्रीज नोट किया गया है।
We have now floated one corona tracking app in the mobile, and if anybody visits our GCC's website, and if anybody is having an Android cell phone, and they can immediately download it. If somebody is having it's applicable for general population. If somebody is having the symptom, he or she can take a selfie and just send it as per the app's design. It will reach our server, and we will know in which street, of which ward, of which zone this particular person is there, and along with the location we will be getting the full address.
All right, now in midst of all of this, I want to draw our viewers' attention to 11 cities. 11 cities across India have now become what one can call corona red zones, out of which cases linked to Delhi's Nizamuddin meet is rising every day. It's not just restricted to Delhi anymore. These are people who've gone across the country. Now, the jump in positive cases have also been seen in Kerala's Kasaragod, Telangana, Hyderabad. Take a look at all the updates from India's corona hotspots.
India still officially in stage 2 of the coronavirus pandemic, that is local transmission. Standing precariously close to stage 3 of community transmission, as there are now 12 coronavirus hotspots across India. The national capital Delhi itself is proving to be India's corona epicenter, with Nizamuddin area being the reddest zone, and now proving to be the super spreader across India. As many as 24 people who took part in a religious congregation in Nizamuddin have tested positive. This congregation was attended by at least 3,400 people from Tamil Nadu, Telangana, Andhra Pradesh, Kerala and Karnataka. And all states are now showing spikes in cases from those who came from Delhi Nizamuddin's Tablighi Jamaat. This as two Mohalla clinic doctors who attended hundreds of patients have got infected in Dilshad Gardens, Babarpur area and Maujpur area. And now 2 more doctors from 2 other hospitals are reportedly infected. Moreover, 14 medical staff, including top doctors from RML hospital, too have also been quarantined. In Uttar Pradesh's Noida, which comes under National Capital Region, there are total 48 positive cases. Meerut is the second biggest hotspot with 19 infected patients. In the worst affected Maharashtra, out of total positive cases, 206 are just in the state capital Mumbai, where 2 societies in Worli and 1 in Sion area have been sealed. Rajasthan's Bhilwara, which is feared to be standing at precipice of community transfer, now has total 26 cases, with Jaipur recording 35. The other centre to watch out for is Kerala's Kasaragod, where as many as 99 people have been tested positive so far. The corona epicenter in Telangana is Hyderabad. So far, 81 cases have been confirmed in Greater Hyderabad Municipal Corporation limits. Bordering Andhra Pradesh is also registering on India's corona tracker, showing a spike of 87 cases. While Tamil Nadu is also threw up its biggest positive cases till now, standing at 124. All these corona hotbeds are cluster outbreaks. Centre and state governments are keeping a close watch to prevent community spread. Bureau Report, India Today.
All right, we're getting very disturbing news coming in. Now, Tamil Nadu has reported its biggest corona surge in cases till now, and it's a whopping 110. Tamil Nadu has now recorded 110 fresh cases. All of them are linked to the Delhi Jamaat meet. People who attended the Nizamuddin conference are now spreading across 19 districts in the state. This is a massive spike for the state of Tamil Nadu. Till about day before yesterday, Tamil Nadu was nowhere in the red zones of the country recording corona cases, and suddenly is now coming right on top with other states as well. 110 cases in Tamil Nadu recorded positive just today. I want to bring in my colleague Shalini, who's joining us for more. Shalini, 110 cases in Tamil Nadu recorded just today, taking the total to how much now?
Indeed, Preeti, it's very scary. 110 cases and the total is now 234. Yesterday, they announced 50 new cases and said 57 new cases, I beg your pardon, and said 50 of them were linked to the Jamaat meeting in Nizamuddin, Delhi. Today, they announced another 110 and said all of them were linked to the Jamaat meeting in New Delhi, taking it up to around 190 cases out of 234 linked to New Delhi. All these people have a travel history to Delhi. They did stay in Nizamuddin and they came back into the state. What the health secretary did tell us is that over 500 people today who attended the meet came and reported themselves to the hospitals. Around 658 samples have been taken. So we're waiting for more. Once the test comes back, there will be more reports tomorrow, whether positive or negative. However, all these people have been kept under isolation. That's 1,103 people have been kept under isolation. The police is being used to trace the people. District collectors and various teams formed under them used to being traced. All these people scattered over 19 districts. Tirunelveli has around 28 people. Erode has around 22 people. Coimbatore has around 28 people. Madurai, all these districts are emerging as hotbeds right now, and contact tracing is underway. Preeti, in Chennai, also the Greater Chennai Corporation is trying to do a combing operation, going to each household and asking people, do you all have any kind of symptoms linked to COVID-19, influenza or the flu, and taking down notes. All this is going to be monitored over the rest of the month to ensure that they don't leave any stone unturned in combating this pandemic. But it's very scary news coming in from Tamil Nadu today. 110 cases. It's one of the largest surge in cases that we have seen in the country. Yesterday 50, today 110, taking the total up to 238 in the state.
Well, that's it. Thank you, Shalini, for joining us, because the number that you've just said, 2 days, it's taken Tamil Nadu now to come up right in the top 10 red zones of the country. It was nowhere there. Recorded 57 cases today and 110 just today. Most of them. And today 110, all of them have been connected, traced back all the way to the super spreader Jamaat Meet Markaz in Nizamuddin. All right, numbers continue to rise. More news coming in, this time from Kerala. 24 new cases positive, corona cases added to Kerala. If you break the number down, 12 have been reported from Kasaragod, 3 from Ernakulam, Thrissur, Mallapuram, Kannur, 2 each, and Palakkad, 1. That's the latest that we're getting in. 24 new cases added in Kerala. I want to cut across right now to my colleague Gopi, who's joining us from Thiruvananthapuram. Gopi, 24 more positive cases shoots up the tally for the state of Kerala. Would you give us the details?
Well, of course, Preeti, because as you were rightly pointing out, 24 new cases has come from Kerala today, and this will actually take the total tally beyond 261 to be more precise. And further breaking this number down, once again, we have Kasaragod, which is topping this list. Even on the daily data, Kasaragod has today reported 12 new positive cases, and the remaining 12 are from various other districts, including Thiruvananthapuram, Thrissur, Ernakulam, and also from Palakkad. And what is more significant to note that the Kasaragod district alone now has close to 111 COVID-19 positive cases. So certainly Kasaragod has now become a hotbed of this outbreak, and restrictions have become more stringent in that particular district. Now even essential services are not allowed is what we have been told, because the police have decided to take up the responsibility of even providing the essential services to the general public. So none other than the police and the health officers are now allowed to wander or even get out onto the street. So the restrictions have been strengthened, and Chief Minister has just now said that the Kasaragod Medical Center, remember Kasaragod is actually one of the most backward states in districts in Kerala, and there is no medical college facility available there. And the people in that district used to depend on Mangalore, which is in Karnataka, because it was relatively closer. If you're just looking at the geographical data, Kasaragod and Mangalore are roughly around 50 kilometers apart. And after the nationwide lockdown, the national highway border was completely blocked, and also Chief Minister was pointing out that has also created a concern for the people there. 7 people has died so far in Kasaragod after they did not get proper treatment because they could not access the hospitals on the other side of the border. 7 people have died so far. So certainly things are getting a little too dangerous in Kasaragod at the moment, but Chief Minister has now said that the Kasaragod Medical Center will now be functional as a full COVID-19 hospital in 4 days. And also a testing facility has been opened in Kerala Central University, which is situated in that district.
Thank you, Gopi, for joining us with that update. Kerala also now recording fresh cases, 24 coming in from Kerala, whopping 110 in Tamil Nadu. And I want to move on right now to Maharashtra. And yes, news break coming in from Maharashtra as well. Now, Maharashtra has recorded 15 new cases, out of which 14 come from just the city of Mumbai and 1 from Buldhana. One can now clearly say that maximum city Mumbai, the city of dreams, witnessing one of its worst nightmares, recording now till today morning was 206 cases plus 14, now to 20 cases coming in from the city of Mumbai alone. I want to connect to my colleague Saurabh, who's joining us with the latest updates. Saurabh, will you talk us through the latest updates? 14 cases coming in from Mumbai, 1 from Buldhana. The 14 that are coming in positive from Mumbai, are they being reported from the clusters which are already lockdown within a lockdown.
Preeti, this is very disturbing news actually coming from the state of Maharashtra and especially Mumbai, because total number of coronavirus cases in Maharashtra now has increased to 135. And let me tell you that yesterday the total number of cases in Mumbai was 151. Morning, more cases were more coronavirus cases came in, and now more cases. So total number of cases from yesterday to today evening, data is around 30 more cases of coronavirus. So the total number of coronavirus cases in Mumbai right now stands at 181. This is a huge number of cases in Mumbai. Now what we have learned is that many of the areas where this coronavirus patients have been found, they have been in touch with the other peoples as well, and therefore let me tell you, Preeti, that around 144 places in Mumbai are now completely sealed. The people of this area cannot come out, they cannot step out of their house. All the essential commodities will be provided to them at their homes only. So this is a huge cases and the situation in Mumbai which we are seeing, because the private labs which are conducting this test are also been increased. And one more information, Preeti, is that the BMC has issued an order that to increase the quarantine facility, now they will be looking for residential buildings, private cruise ships and marriage halls, gym khanas and all. Whichever places will be empty, there all will be converted into quarantine facilities. So BMC and the officials are trying to prepare itself, but with the number of cases increasing, it's actually alarming.
All right, appreciate you joining us. Saurabh, I want to now move on to my colleague Milan, who's reporting from the national capital, because out of all the red zones in the country, Delhi is, if Mumbai is the corona capital of India, then Delhi is also one of its epicenters. The reason why, Milan, clearly comes down to what happened in Nizamuddin. Sudden spurt in cases in Tamil Nadu. 110 in Tamil Nadu have reported positive just 1 hour ago, tracing their travel all the way to Nizamuddin, Delhi. Get us up to speed in terms of where Delhi stands right now in numbers and preparedness.
Well, Preeti, as per the Health Ministry numbers that we are looking at right now, Delhi cases are 120 now. That includes foreign nationals, and 6 are, cured. We have reported already that there are 2 deaths. But Preeti, more important, if I tell you the numbers in terms of what happened inside the Markaz building and how many people were quarantined, the Chief Minister Delhi, Arvind Kejriwal, has told us that around more than 540 people are being tested inside hospitals in Delhi. 1,800 people are being quarantined across Delhi. And there have been a rise in cases of those who are tested positive. As far as connections with the Markaz is concerned, they are in Tamil Nadu and other states as well. But shockingly, there have been a lot of people who have put a lot of load on the hospital and the facilities now, the testing that is going on, and surely it's going to increase numbers even further because we are looking at an overall India number of more than 1,400 COVID cases now. And even the Union Health Ministry, Preeti, very importantly informed us that there has been a sudden spike in the number of cases, not just in Delhi but throughout all states, and they have named the congregation of Tablighi Jamaat that happened as one of the main reasons, also making Nizamuddin area a hotspot for the ministry to make it into a containment area. Remember, in Bombay they've already started making containment areas, which means they'll quarantine everything and no one will be allowed to step out. A similar situation could be seen erupting in Nizamuddin as well after the current situation.
All right, appreciate you joining us. Thank you. Meanwhile, I just want to shift focus. In times of crisis, scientists and innovators have come to the forefront, demonstrating and building new machines, technology to fight challenges. With the onslaught of the coronavirus across the world, there are such innovators in India who are claiming to have had breakthroughs. My colleague Nolan Pinto in Bangalore went to talk to these innovators. Let us see what he found out.
There is a new breakthrough device that claims to effectively neutralize coronavirus. Necessity is sure the mother of invention, and This doctor, a Bengaluru-based scientist, has invented a breakthrough device.
It's not a medical device, I should make it clear. It's a device that basically works on the neutralizing of the spike protein, the S protein of the COVID-19 virus, so that the infectivity is reduced to a large extent. So the idea is that. And this device can be used in, hospitals, in, contained areas, quarantine areas, in places where public meets, shopping malls, schools.
The scientist claims it disables the virus by bombarding the area with trillions of hypercharged electrons per second. This breakthrough device, it is being claimed, has been tried and tested, but as of now the government of India is still to give its stamp of approval. US and Mexico are also testing the efficacy of this breakthrough device made in India, says the people behind the discovery. While the device is not a cure, it is aimed at containing the infection by disabling the virus. Not just this device, startups in Bengaluru have also developed an effective low-cost device called Respirate. It is a portable ventilator, they say.
Your system, this device that you have actually come out with, how will this save lives? Can you just please explain to us?
Sure. So this device is a portable handheld device. It can provide intermittent positive pressure ventilation. So when a patient has respiratory arrest due to comorbidities COVID-19, so a patient who has pre-existing conditions and there are no enough ventilators in hospitals, this can come in handy. So this can actually save lives and it can be used as a life support as an intermediary. As you can see, this is automating the ambu bag, just like simulating the patient motion. So it is giving inspiratory and expiratory ratio, it is giving breath rate, it is giving tidal volume to the patient who is requiring a mechanical ventilation.
The innovators claim that where there is a fight for ventilators in hospitals for COVID-19 patients, these kind of affordable devices can stabilize patients during respiratory arrests by mechanically providing intermittent positive pressure ventilators. While talks of mass production are on, it is being said that this device will cost less than 50,000 rupees, which is on the lower scale than regular ventilators. This story filed by Nolan Pinto in Bengaluru for India Today TV.
All right, so this is disturbing news, and we are getting in news, and it is a confirmation that the first coronavirus case has been detected from Dharavi in Mumbai. That is the latest that we are getting in right now, and I want to bring in our Mumbai Bureau Chief Sahil Joshi for more. Sahil, this could be very, very, very worrisome.
Of course, this will be quite worrying, specifically for the administration, because Dharavi is a very congested and a densely populated area. And in that area, one person who has been found now corona positive, it will be difficult for BMC to actually identify the cluster and seal it properly and avoid that it should not be, the contamination should not spread among the community is going to be a tough task for the BMC. But of course, the BMC officials have already sealed the area where this particular person was living in, and they are taking all the precautions to identify that who can be the direct contacts of this particular person or who can be possible contacts of this particular person, and then accordingly the rest of the people will be put into isolation.
All right, so I'll appreciate you joining us because this is worrisome. Mumbai already has 146 red zones. Red zones practically means a lockdown within a lockdown. Some of these localities who are now recording cluster outbreaks are completely quarantined in the sense that most of them can't even get out to get their groceries. Every essential is being bought to them. Dharavi from Mumbai has now also recorded a space. For anybody familiar with Mumbai would understand why it's worrisome. For those of you who are not, Dharavi is one cluster which is extremely congested, possibly one of the most congested clusters across the state of Maharashtra and possibly India. We're going to keep a keen eye on all the developments We're going to go into a quick break. When we return, news and updates continue with our consulting editor Rajdeep Sarvasai. Do stay tuned and thank you for joining us. And ultimately do stay home because then you'll stay safe. Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.